Hi there. In this video, we will take you step by step through the MedAlly Diagnostix module. Let us move into the Recommendations tab under Diagnostic Assessment. This section helps you understand the evidence-based recommendations and the implementation details. These recommendations outline what should be done next, along with clear guidance to support clinical decision-making. In this tab, you will see different categories of recommendations such as implementation details, supporting evidence, contraindications, and alternatives. Implementation details explain how to apply the recommendation in real clinical practice, including the practical steps or actions needed. Contraindications outline situations where the recommendation should not be applied due to potential risk or harm. Supporting evidence highlights the clinical or research-based justification behind the recommendation. Alternatives present other options the clinician can consider if the primary recommendation is not suitable. This allows clinicians to quickly review the most appropriate next steps, supported by structured guidance that fits the patient's condition.